You're listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. So welcome to Parent MD. Today we have with us a guest by the name of Eric Storch. Eric, thanks for joining us.
Hey, thrilled to be here.
Dr. Storch, today we'll want to have a conversation to learn a little bit more about you. So let's start with hearing about where you're from, your background, your education, and your career path.
Okay. So I am from Houston, Texas, and I started off years and years ago getting my training at Columbia University in New York City. Now, from there in clinical psychology, you get matched in a system, a little bit similar to as a physician in residency. And so I was fortunate to match down at University of Florida in Gainesville, which then later became my first academic job. Moved down to University of South Florida shortly after, and then about 3.5 years ago, became a full-fledged Texan.
So we came to know each other because of a common colleague, Dr. Stephanie Eakin, who's working with me on helping. She's co-chairing our clinical advisory council for Parent MD. And you all both appears are on the same speaking circuits often in the mental behavioral health realm, and OCD is your focus. With that being said, we talked about this a little bit in an interview this morning, which is on the toolkit for OCD, which you helped to build, and we appreciate you doing that. So you're actually in our studio today helping us build a toolkit for OCD for parents and one around research and statistics for parents, which it's a great mix and obviously topics that I think a lot of parents will enjoy, and I'm going to look forward to listening to more myself. When it comes to your space of speaking on OCD around the country, as you met Dr. Eakin, you have a lot going on in the realm of education, research, along with clinical practice. So tell the group a little bit of how you had such a strong interest early on in the space of education and research and answering questions. I think that's fascinating.
Well, thank you. And I'm thrilled to be able to connect here, reconnect with Stephanie, and do this, because I think getting the information out to parents is so critical as one of our most important stakeholders. I was just lucky, I guess. When I went down to University of Florida, there was a perfect opportunity to kind of step in and fill a gap within our OCD clinic. We had a couple of brilliant psychopharmacologists. We had a psychologist who ended up being an incredible mentor to me, but also gave me the platform to really build out a behavioral therapy treatment center where we wanted to engage research and really embed our research within our practice. Now, at the same time, educating the next kind of crop of professionals was critical. And we realized that early on because there wasn't sufficient access to the treatments that worked. And so from the get-go, we really developed this mission where we had our clinical practice aligned with our educational efforts as well as our research efforts. Wow. And all of them scratched the others back. And so at every place that I've been, we've really set up the exact same model where we're engaged in scholarly activity while we're sort of building out the next generation and, most importantly, helping those who are affected.
When you think about research and what meets your needs to satisfy your intellectual curiosity in your space, what kind of questions are you most fascinated with, and what are you still trying to answer, and what questions have you answered?
So I was recently received an award, and it was as distinguished alumni of my doctoral program, which I'm positive I was thrilled. On a negative, I was like, are you considering me an old guy? Uh-huh. I still got a few years left here. But what was cool is that they asked me to make this presentation of sort of the path that we've been. Sort of that college, that book that we give all of our kids going to college by Dr. Seuss, The Places You'll Go. Yeah. It was exactly that. And so when we started, our questions were pretty basic. How do we measure OCD? How do we treat it? Like, what works? And then how do we get it out there? Now, we've addressed those initial questions. The measurement stuff we sorted out long ago. The treatment stuff we sorted out. And even started going into this domain of understanding why the interventions are working. How do we make them better? And then how do we get it out there to everyone? Now, there's still a lot of room. So one of our areas that we focus on is how do we more accurately measure things, and by taking technology. how do we think about kind of policy and impact policy so that not only do we have more availability of expert providers, but we're making that a requirement that people are doing these types of treatments? And then how do we have more innovative approaches? For example, as we know more about genetics, as we know more about the way the brain works, how can we leverage this information to make our interventions much more effective and maintained over time? And so these are some of the areas that really excite me to get out of bed to think about how we can answer and change that field.
So what questions do you find that parents are most intrigued and they most want you to answer, not just for the field of medicine, but for them as parents?
I think one of the biggest ones is sort of a straightforward, but for me, profound one, which is how do I help my kid?
Right.
And so what I always say to them is, you help them by being here, by being a part of this process, by being engaged, by prioritizing this. And I think that's an answer that they appreciate and love because that's what they want to do.
Yeah.
The other questions are things like, how do we, my child's on a medication, how do we get them off this medication at some point, or will they be on it forever? Another one is, what do I do if my child hasn't benefited from early treatments? And so all of these are really questions that we're trying to answer to understand what are our next line of interventions, what are the next kind of things that we do to help those that remain affected.
So I thought you were going to go straight to the biggest question I think probably most parents probably have is why? Why does my child have OCD? What caused this, the causation component?
Yeah, one of the reasons why I didn't go there is because it's so unclear. And what we know is, I mean, it's a multi-determined condition. There's a genetic aspect to it that's there, it's real, it's significant, but it's not the complete picture. There's a behavioral aspect. If you're scared of something and you stay away from it, you feel better, but you don't learn you didn't need to be scared of it. Right. So it perpetuates that cycle. Yeah, there's the way that our brains sort of operate and are wired as well. And so all of these things together sort of result in this presentation of OCD. And the beauty about this, however, is that we can intervene at different pathways with different types of approaches and still have a really good effect. I don't really know why it happens, but I'm glad that we have a bunch of tools on our belt where we can address the problem and make sure it doesn't happen again.
So obviously there are questions that parents have and you have from a research standpoint you'd like to answer. What are the biggest frustrations that parents have when going through this process from the point of diagnosis, treatment, maintenance, and then the child growing into an adult with OCD, and if they haven't been able to manage it, what are the biggest challenges that they face?
The primary challenge is one of access to good interventions.
Yeah.
So what we've seen in the field of psychology and psychiatry is that it's really hard to access treatment. So 20 years ago, we knew what treatments worked. We needed more data, but we still had a good sense. But you couldn't really get at it unless you were in a town with an academic medical center. Now we've spent a lot of time. I've traveled a lot of miles training folks around the country, around the world in this space, and we're making traction.
Right.
A lot more to do, but we're making movement. But at the end of the day, that access issue is a massive one. Insurance companies tend to pay at such poor rates that most mental health providers, if they're outside of an agency that would be contracted with insurance, they're not going to do that because they just can't make a living kind of accepting insurance.
Sure.
And insurance will sometimes dictate the type of care they can provide. And so that's, I think, a big challenge. Now, what people who are listening can do is reach out to some of these academic medical centers where they take insurance, where they may have training clinics. And that's something that we've very thoughtfully done at each institution where I've been in a leadership role, is ensure that not only do we have a clinic where we accept insurances, but we're also able to have different research studies or different training clinics where we can have people, regardless of ability to pay, receive care for their OCD.
You take my mind to many different places. One of those is obviously the team that has to be had around. So one, I'd like you to talk a little bit about that team because obviously you can't do it all on your own, right? And you may need a psychiatrist to prescribe medicine sometimes, but there's obviously other interventions that require other therapists and such. So what all kind of a team do you have around you besides the research team to answer these questions, but what about when it comes to the therapy?
What's the saying with kids? It takes a village to raise a child.
Village.
Yeah, sort of like that with an OCD, and so one of the beautiful things about the OCD community is its closeness, and not just to one another, but a dedication to helping individuals affected.
Right.
And I raised this earlier within the toolkit. This idea that if you have a question, email me, email one of the experts, but reach out. There's always a few minutes to talk, respond to an email, but to guide a family in the right direction.
Right.
In order to treat someone with OCD, the team also has to include a number of folks. Now, we work very closely with psychiatrists. We have a couple terrific psychiatrists on our team. In the context of my clinic, we have a specialty in working with folks who have been treatment refractory, whether they're kids or adolescents or even adults. And so among our adults who have failed every other intervention, we actually do a lot of research on different types of neuromodulation, one of which includes deep brain stimulation surgery. And so we'll have nurses, we have a neurosurgeon with whom we work closely, as well as a number of faculty. Now, one of my loves is working with patients, but as I've become more involved in research, more involved in administration, that clinical time has decreased. So I spend a lot of my time with our various faculty and postdoctoral fellows providing support and supervision so that we're able to increase the bandwidth that we have for caring for more patients.
So let's go down another path for a second. So you talked about being a space of less clinical time, more administration, more leadership, research, teaching, all these kind of things. Obviously, I think you're the type of person, you're very fulfilled by all these. Do you feel, though, that also you have a bigger impact in medicine and on society by being able to play these different roles, because you get to have an impact on policies and procedures and educating the masses and helping get resources to folks and find answers that actually improve the quality of care, doesn't it?
Yeah, I think you nailed it. One of the signs I have is something I have framed in my office, is my favorite saying. And it's, to the world, you may be one person, but to one person, you may be the world.
Yeah.
And it's thinking about the impact of the work you do on the individual basis. Now, with the research in clinical care, you can make such an impact. That clinical work that you do and the impact you can have on the family is just, it's inspiring. The research piece as well is something that's really fulfilling. And being able to see the literature from the work that we've done, as well as many other wonderful folks, dedicated researchers and clinicians, it has really been transformative. And we really have witnessed in a couple decades the field come from a nascent state to one that's relatively mature. And so being able to see that and see people from around the world use our assessment tools, use our treatment protocols,
right,
find similar effects, all of this is really, really fulfilling.
So have you seen that over the last year, as COVID has entered our realm and everything's become more virtual, everything in mental behavioral health has definitely gone more down a virtual pathway. Have you seen that help induce more innovation, more collaboration, more access for patients? You talked about earlier the geographic disparities of not being near academic centers. And if you're closer to an academic center, you're likely to get more access and more collaborative team approach. But with the realm of virtual care today, is that not breaking down some of this, where patients can access folks from anywhere and it doesn't have to be in person anymore?
Yeah, it has had a positive impact, but there's still some areas that remain. I think one of these aspects is really being able to access care more easily. And just think about it from the standpoint of a parent. In Houston, which is known for its traffic, being able to go from point A to point B, even if a couple miles away, is a 30-minute endeavor each way.
Oh, yeah.
So we've addressed the fact that you don't need childcare. You don't need to do anything except click on a link and you're in. And for 80% of folks, that's perfect. It works, they like it, it's convenient, and we've improved access. And of course, you can be across the state in Texas, which we've really had taken place quite a bit. So our geographic catchment area has become the entire state. Now, on the negative side, that issue that we talked about with insurance reimbursement still persists. So that the number of providers who are able to take insurance remains the same.
Right.
So that even though we're able to see folks from the Rio Grande Valley region in Texas with insurance, it doesn't mean that other providers are able to do that. So it's a step in the right direction and absolutely a silver lining, but we do need to try to address that remaining issue.
Let's change gears for just a moment. Research and statistics. So Dr. Eek and I were really excited to bring you in to meet with our group to not only talk about the areas you have clinical expertise, but also to talk about your interest and your communication with parents around, how to be more aware, informed about how research is performed, but also how to interpret and understand statistics, to understand the math, the definitions, the application. This last year, I think we've never had such a need and a hunger from the public to understand and need to understand correctly research, how it's done, and to understand the statistics that are talked about, whether it's the incidence or prevalence or associated risk, or talking about this test, and we've had all these tests, PCRs, rapid antigens, antibodies, and people are now having the common lingo of talking about sensitivity and specificity, and then now in the whole realm of vaccines, FDA approved, not FDA approved, clinical trials. What does all this mean? And because of the internet, the public has gotten in the news. They've gotten up to speed for a lot of reasons. They've had access to information, and they've had a hunger. So with all that being said, and with what you share with us and help to build a toolkit for parents to understand about research and to understand how to interpret statistics, what do you think was the biggest challenge for parents over the last year when it came to COVID? And all the things they heard, what was the most frustrating thing for them in hearing all this? And for me, I'm just going to put it out there, it was who to trust. Mm-hmm. Because, Mark Twain said there are lies, there's damn lies, and there's statistics. And you've got all this information from all these different sources. And for so long, I think folks have just said, well, I'm going to trust my doctor. Or if it's said on the news, I think I can trust it. But this year, because there's been so much about COVID every day, parents and the public have heard so many different sources say many, I'm going to say, conflicting things. Mask, not wear a mask. And we're not going to get into all those. But from the statistics and research standpoint, what was the biggest challenge you think to parents over last year?
I actually, you nailed it. It's who to believe, what to believe. And so I'm a big believer in science. I'm a big believer in the fact that our government really has a sole interest in trying to do the right thing. Yep. And sometimes they get it right. Sometimes they get it wrong. It's not the point. But I think from the statistics standpoint, they're really trying to make sure that people are safe and healthy. Right. And not only is that sort of a moral issue, I think it's an economic issue too. So I think the information and disinformation and deciphering what's accurate and so on has really been a challenge for every consumer of this. Yeah.
I think the most challenging thing when it comes to statistics, and I don't remember what doctor I heard say this years ago when I was in training, but somebody said it, and it's stuck with me ever since then. Said, when something happens to you, it's 100%. It's not 1 in 10 million or 1 in 10,000. And if you think about it, that's the way we all are taught and decisions are made. It's all about risk versus benefits. It's about likelihood. And at the end of the day, every person, every family has to get information, digest it. They have to get good information they trust. They have to be told how to digest the information and then make decisions for themselves and their families. And for us, we feel the clinicians are your partners. And there are some good sources on the internet to get informed. But at the end of the day, you have to decide what the risk and benefit is. But always remember that there's a lens that everyone else is looking through that's not of you as a parent or you as a patient. And that is what's best for society and what are the odds, what are the risk versus benefits. But that truism, though, that when it happens to you, it's 100%. Mm-hmm. And it doesn't matter it's 1 in a million because now it's me and it's 100%.
That's right.
That is the hardest balance. And at the end of the day, thank goodness, that's why, we live in a society where people make decisions for their health. And then the other conflicting hard part about this conversation over the last year, again, regardless of your beliefs, decisions have to be made by those above in government and other doctors that are best for society at times. And I think this has been the hardest one over the last year. And it's not black and white. That's my big thing. It's gray a lot of times. And I have seen myself changing my opinion, my stance on a lot of these things through the months. And some of it, so you get more information or you think about it or hear it or see it through a different lens. My point of that being said is I want to get your reaction to the fact that even when you have science and information, we all have biases. And that's a big piece of research, right? Is you got to make sure you're removing the biases. But at the end of the day, you look through so many lenses, and we look through them as a lens as a parent, a clinician, a society leader, a scientist, but then related to ourselves and our parents. And everybody's always asking us, do you get this, or should you get this test, or wear this mask, or this test? But at the end of the day, it's not always clear. It's a moving target, I think, is the other lesson. But my encouragement to everybody is learn as much as you can, be as educated, weigh the risk and benefits for yourself, and really also listen to as many perspectives as you can, because your perspective may change if you open your mind. Would you agree?
I do. It's advice I always give, especially my trainees. Do reliability checks. I'm giving you a perspective. I think it's right.
Yeah.
But you know what? I also thought I'd have a full head of hair my whole life, and it's not working so well. So check someone else out. Hear what they have to say. Do your own research and think for yourself based on the data. What I love about science is just what you said, the Mark Twain quote, the numbers don't lie.
Yeah.
And so it's up to you to kind of evaluate those numbers and do so, on behalf of you, your family, to make those decisions that work for you.
Exactly. You have to weigh the information. First, I think you have to vet your sources. And then for us as clinicians, our litmus test in making decisions always has been for me, and I'm sure it is for you, and I think for all clinicians is, what would I want done for my child? And that was always the only best way I could give parents when they were asking me what we should do. Like, there's 3 different ways to approach this. But if you want to know what I would do for my child, this is what I would do. But at the end of the day, too, that may not be what's best for you and your child. So for those that feel like it's straightforward and got it all figured out, that's great. I think it's evolving. And then also I look and recognize that I've evolved in my philosophy over a lot of things over the last 20 years. So I think keep an open mind when you look at all this.
Well said.
So wrapping up our conversation today, we could talk, I think, for hours on some of these topics and appreciate your perspective. As a parent, let's put the hat on as a parent now. We've got a lot of parents listening, and they're looking to Parent MD for advice and recommendation and information around these various topics. But I always want to ask everybody to share with our parents, what's some of the best advice you have for them as parents? Just away from the clinical side, what are some nuggets you've learned through the years that you'd like to share with parents? Yeah,
I think there are several of them. The first is that you're not alone. So you really have to reach out, but there are people who care and are going to support you. And so building kind of that support network around you to support your child and whatever is needed is critical. And that includes, whether it's a psychiatrist, pediatrician, psychologist, therapist, your spouse, whoever it is. But I think that's one piece.
Right.
Second is, you said this earlier, find your trusted sources of information and keep going there. The internet has a wealth of good stuff, but it also can be just a rabbit hole. So sort of avoid that piece, have the places that give you some good stuff, and stay right within that. Third is, sometimes more is better, sometimes it's not. What I mean by that is that you can also make huge progress when you invest in 1 or 2 different areas, as opposed to, at a lower level in multiple different areas.
Right.
Another piece of advice is really what may be a conflict now in different ways. It really doesn't matter in the scheme of things. And so what I mean by that is I'll have some folks, they'll talk about, well, we can't fit in treatment this week because we have piano and baseball practice and so on. And pretty unlikely that Johnny's going to make it to the majors. Right. So let's focus on some of these problems now, making sure that he's getting there doing the things he loves. But again, set your priorities and keep straight and keep them at the top. And then the last thing is don't ever stop trying. It only takes one time to kind of turn the key, get it right, and just change the trajectory of everything.
Yeah. Well, I appreciate all your advice, wisdom that you shared, and really appreciate all that you do for children and families. It's very palpable. your heart for taking care of people. And one of those that came out to me just during this conversation when you said you invite people to email, reach out to you, as you have a heart for helping people, even though you're in this world now of outside the clinical medicine, more and more inside of research and administration and education. So pleasure for you being with us today. Really appreciate your help and guidance and instruction on building the OCD toolkit and the research and statistics toolkit. I think that's going to be very exciting to a lot of parents and a resource that hopefully they'll appreciate. So thanks for being with us.
It's terrific to be here. Thank you.
Thanks for being a partner with Parent MD.
Absolutely. Thank you.
Thank you. You've been listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. If you enjoyed today's episode, go ahead and click on that follow button on your favorite podcast app. It's the best way to make sure you never miss a single episode. And while you're at it, why not leave a 5-star rating and comment as well? We'd love to hear your feedback, and it helps other parents find the show. The Parent MD podcast is a part of Parent MD, a new way for pediatricians to help parents. Parent MD is an online source of parent information you can trust, straight from board-certified pediatricians. For more information about Parent MD, visit us at our website, www.parentmd.com. That's it for this episode, but we will be back soon to tackle another topic to help parents make confident and informed decisions about their children's health.